Next speaker is my friend, my brother, my student, my colleague, whatever you call him. And we are working together at least since last 14, 15 years. And whole this transdermal marma system generated with his inspiration. And he is, among all my practitioners, he practices transdermal marma system the best. Very nice, very nice. He is practicing in Maryland, and wonderful practice he has. One thing I would like to tell you, he understands my lineage Ayurveda so quickly, like he knew from the past life. Just he listens it, adopts it, practices it, and that's it. Next time I go, yeah, I have done that and I have a great achievement. And then when he explains to the patient in front of me, amazing, amazing. I'm blessed with all students, but he's very special. So without wasting time, I would like him to come and give his presentation. Give him a big applause.
So, I like to move around. So I got to make sure I'm not going to get tangled up. Good morning, everybody. I'm Doug Beech, and thank you for having me here, and thank you to Dr. Mishra and Melina for inviting me to this conference. It's truly a pleasure, and it's truly a satsang, because I'm seeing all these spiritually minded people sitting in the audience. Not everybody appreciates what we have in SVA, and the people who would take their time to come to this conference obviously do. And it means a lot to me to see you all here. Now let's see if I can get this thing to work. So the title of my talk, I said, well, what do you want me to talk about when I asked Dr. Mishra? And he says, I don't know, anything you want to talk about. And I said, okay, well, I'll just make it a general thing, how we integrate SVA into my practice. And then I told him that like 6 months ago, and then I decided, maybe a couple of weeks ago to actually write something. And it came to mind this title, The Practice of Satyuga Medicine in Kali Yuga. Because I was writing this mostly for practitioners, although I hope that other people who aren't practitioners enjoy it. But I was thinking of the challenges that occur in trying to integrate this type of ancient knowledge into a modern setting. And so I want to talk about that. And really, well, before we do that, let me just do one other thing. Just who am I? I've been practicing TM since 1974. I'm a teacher of TM since 77. I graduated from the University of Tennessee in 1980, and I became a chiropractor with Dr. Teitelbaum in 1984. We were classmates. I've been a practitioner. I learned Maharshi Ayurveda in 86, and then I've been a SVA practitioner with Dr. Mishra since 2001. And when I thought about what to talk about today, I realized I could talk about a lot of different things, because having been in practice 30 years, there's a lot of tricks that you figure out about how to do things. One thing I've learned about when I give a talk, if I go into too much detail about too many things, it gets lost. And so I decided I want to pick one thing that I think is the most important thing that a practitioner needs to know. And I want you to know where this came from. It came from Vaja, where everything comes from that I know. When I first started practicing Ayurveda with Dr. Mishra, we were both working in the TM organization, and I was covering at the Ayurvedic clinic in Bethesda, and he would come there to see patients, and I would sit in with him as the doctor, licensed for that purpose. And he had asked me to study with him, and I was doing that, and we were working together pretty closely for several months. And then I don't know if you remember this, Vajra, but at one point, the word came down from the TM movement that Vajra wouldn't be coming back anymore, that he wouldn't be making any more tours. And I was heartbroken. I thought, oh my goodness, finally I found someone who I can really learn from, and I get this little taste, and then it's going to go. And so we were sitting in the office there at the Bethesda Peace Palace, and I said, there is so much that I want to learn from you, so many things. And I know that if I studied with you for the rest of my life, I'd never be able to learn all the things that you know. So I want to know one thing. There's only one thing. If you can teach me this one thing, that'll be it. I'll be happy. And I said, how is it that you sit with every patient and tell them exactly what they need to know? How do you do that? If you're a practitioner and you sit with Dr. Mishra, one of the most amazing things is to watch him see 18, 20 patients and tell them all something different. Because I've sat with a lot of other practitioners, and that's not always the case, usually not. Usually it's the same basic structure of things goes over and over again. So I said, how do you do that? And he laughed and he said, like he always does, and he says, Doug, he says, it's interesting you asked me that, because he says, I asked my father the same question. I'm going to tell you what the answer is. That's what this whole presentation is about. And this is how you integrate Satyuga medicine into Kali Yuga. But first, let's satisfy the mind a little bit. And thank you, Melina, for all that beautiful description of Sattva, because it plays right into what I'm going to talk about, because we're talking about Satyuga. So the Vedas describe that there are 4 epochal periods known as the Yugas. Satyuga is the time of Sat, or truth. Sat means literally ultimate truth. And during this time, this is how Maharshi used to explain it. It said, during this time of Satyuga, all the laws of nature that support positivity, growth, evolution are awake, and they're supporting all life on Earth. So it's very easy to be connected to your sattva in Satyuga. In fact, you can't help it. You're connected by the very nature of being there. In Satyuga, humans connect to the sattva of their own soul. This naturally reflects in humans as humility and respect for creation and the laws of nature. Ayurveda, and specifically SVA, is a product of Satyuga. Kali Yuga, which is where we are now, we're in Kali Yuga. Kali Yuga is the polar opposite of Satyuga. The laws of nature supporting evolution are asleep, and the laws of nature supporting materialistic and sensory experience are wide awake. So it's just the opposite. In Kali Yuga, humans in general are more connected to their senses, and the ego dominates the mind. This often results in technologies that are sometimes outright destructive, such as WMDs and that type of thing, and others that provide benefit, but often at a cost of negative side effects. And this is the world that we live in today. So basically, Kali Yuga, we become attached to the senses so easy, as Melina was explaining that whole connection between the Mano-buddhi and the Satya-buddhi and all of that. That connection is harder to maintain in Kali Yuga. You have to work at it a little bit. SVA is Satyuga medicine. It came out of Satyuga. Ayurveda comes out of that ancient knowledge from the rishis. And modern medicine is Kali Yuga medicine. And what does that mean? It means that it comes out of sensory experience, the mind attached to the senses. So how does that give rise to different structures? Oops. In SVA, we would say that's an intelligence-based model because it comes from the inside out. And nature, in its very essence, is intelligence. Sangita, pure consciousness, is pure intelligence. When it manifests and becomes prana, that first ripple of vibration of consciousness becomes marud, agni, soma. That is all of nature's intelligence manifesting itself. SVA comes from the inside out. It's an intelligence-based model. Modern medicine, which comes from the outside in, sensory-based, is a mechanistic model. It basically sees the body as a very sophisticated machine. And therefore, the therapeutic approaches tend to be mechanical approaches. You stimulate a system, you depress a system, you take it out if it's worn out, you replace it if you can. That's basically the allopathic model. In SVA, human beings are a perfect reflection of nature. Health is the natural state of alignment with nature. Disease occurs when natural processes are not allowed to function properly. So what do we do to heal a patient? We allow the natural processes to function properly. We do just what Melina was talking about. We open the channels. We allow the transition to occur in the gap, everything. We just allow the body to be healthy because we start with respect, an ultimate respect for nature. In modern medicine, human beings are an exquisitely designed machine, and the term health is pragmatically used to describe an asymptomatic state, meaning if you're not sick, you're healthy. In SVA, both objective and intuitive measurements and observations are utilized. And in modern medicine, only objective measurements and observations are considered valid. It's a very significant difference there. Okay, so what's my point? My point is this. Practicing a 5,000-year-old system of medicine based upon a natural respect for nature, which utilizes cooking of fresh food daily, fresh spices, unprocessed foods, perfectly prepared herbal preparations, maintaining nature's ultimate vibrational intelligence, prabhava, and get to bed by 9:30 at night, is a little like this. It's very difficult to practice. The context isn't right. We're not in Sat Yuga. Trying to translate these concepts to patients, even more than translate the concepts, trying to get them to do it, is a very, very difficult thing. It's a challenge. And we lose patients because of it. How many here have lost patients because they just said, I can't do it? You know, as Dr. Mishra says, but I have to tell you, otherwise I'll go to hell. You know, we have to do what we do. And what's more, you must, and this is as a practitioner, this makes it even more complicated. You have to meet documentation standards, proving medical necessity. You must accurately diagnose and limit your treatment to your scope of practice. Patient education about Ayurvedic principles and practice, cooking, spices, use of products, and all that kind of stuff takes a lot of time. You have to figure out how to get paid for your services while you're doing all this. And you have to do it fast enough to see more than one patient a day. It's a challenge. Oh, there's me. I just saw myself. All right. And a few other things. You have to manage, this is just for practitioners, I guess. You have to manage an office, pay your staff, keep up with the latest technology, keep up with the continuing education requirements, stay abreast of insurance guidelines and regulations, anticipate changes, coming from Obamacare, and it just seems like a lot of stuff. And it is. I like this one. Isn't that pretty good? That's how we feel sometimes. And then there's some challenges with patients. Okay. Patients want instant relief, like yesterday, because that's what they've been trained. You take a drug, it goes away. Pop, pop, fizz, fizz. They've read about Ayurveda. They want to know their body type. We don't talk about body types too much, but by gosh, they want to know. The patients are often seeing 5 different practitioners simultaneously and they're taking 30 different nutritional supplements as well as prescribed medications. They don't know how to cook, or they don't want to. They want your diagnosis so they can then go self-treat while picking and choosing which recommendations and products they want to take. You know, I love Indians. There's a lot of Indians here today. But Indians love to come to me and say, "Oh, Dr. Beech, just give me your diagnosis." And then they go away and I never see them again because they go and buy it all from banyan herbs and they do all that stuff. That's what happens. And then also, not everyone who walks in through the door is ready to hear about Ayurveda. And so we have to be able to figure out which ones, to cross that line with, right? Who do you express this to and who do you not? Because we're in business. We have to, make a living. And if we run them off because we start talking about sattva and they're just thinking, for chiropractic, I just crack my neck and let me go. We have to figure out which ones to talk to this stuff about. And a few other things. All the previous slides that I just gave you are expressions of Kali Yuga. This is how we think in Kali Yuga. The mind gets attached to the senses and we get lost in the details. How am I going to do this? How am I going to do that? We worry, we think, we do all that. But we practice Satyuga medicine. We practice Vedic medicine. The Veda offers solutions for all problems. That is absolutely true. So what is the Vedic solution? What wisdom do the ancient rishis offer to us practitioners in this modern age? How does a successful SVA practitioner do it? That's it. This is how you practice Satyuga medicine. Come back. We start from silence. Silence is the platform of activity. Silence puts us in touch with nature. Silence allows us to speak from Satyam. Silence corrects all the mistakes of the intellect. Starting from silence is what sets SVA apart from other systems of medicine. There's a verse here that didn't come out on the slide, but it's from the Gita. It's Yoga sta kuru karmani, which means established in being, perform action. This was what Lord Krishna gave as a prescription for Arjuna in the Bhagavad Gita. He said, before action, become silent. And out of silence, the right action will come. So this means in our daily life as practitioners, we should meditate. We should go and practice Yoga sta kuru karmani. Nistra gunyo bhavarjuna. That's what Krishna said. He said to Krishna, be without the three gunas. Be without sattva, without rajas, without tamas, without anything. Go to that field of complete silence, and then out of that, perform action. So how do we do this in our office? I didn't realize it had switched. In the office, our technique is Nadi Vigyan. That's our meditation for practitioners in the office. This is how we function from being, from silence. As a practitioner, take the patient's pulse, and this is what the answer was to my question when I asked Dr. Mishra, how do you know what to say to each patient? How can you possibly know that this one needs to be yelled at, this one needs to have their hand held, this one needs to be told about God, and this one needs to know everything about diet? How do you know that? This is the key. He said, take the patient's pulse before anything else, before any conversation, before any history, before any prescriptions are given. When performing marma, he didn't tell me, this is my own thing, but when performing marma, take the pulse before and after each application of the transdermal cream. See what the wisdom of the nadis is after each application. The nadis will tell you what your next step should be, always. It's all there. Everything you need to know is in the pulse, which is reading the sattva of that patient's light. So when you don't know what to do nothing, and right action will come. When you can't figure it out, go to the pulse. Go to silence. Do nothing. And then everything comes from that. Be yourself and all becomes simple. When you operate from the simplest state of awareness, you're being yourself. You are standing on the platform of the self, and all the knowledge that comes forth is Vedic knowledge at that point. Nadi Vigyan is the tool to operate from our level of sat, our level of truth. It's the window we use to peer into the deepest level of our patient's body, mind, heart, and soul. My greatest gift comes when I watch Vajra see the pulse. This is what I love to do when he comes. He doesn't know I watch him, but I do. He touches the pulse, gently gliding into each level of the dhatu, sometimes for a short time, sometimes for longer. Then he usually sits back with his eyes closed, and he tells me his observation in the technical language of the pulse. Finally, then he opens his eyes and begins a divine discourse with the patient. This is a key to practitioners, because I asked you once, I said, it seems like when you take the pulse that the information that you're giving me comes after you've taken the pulse, not while you're taking the pulse. In other words, the intellect. And he said, yes, that's the way it is. In other words, take the pulse from here. Then analyze what you felt later. You know, a few seconds later, but not while you're doing it. Take the pulse from here so that you can connect to your light and the patient's light. And then everything comes. So the silent discourse. The discourse comes from the silent vibration of sattva. The questions are exactly the ones that should be asked. They elicit the exact information from the patient that's needed to formulate the proper prescription. The patient feels that Vajra knows exactly what they need, empathy. Nothing's more powerful than empathy. This gives confidence to the patient that he or she is in the right place. It relieves doubts, and it inspires compliance in the prescriptions. So let me give you an example, because when I was writing this a couple of weeks ago, this patient came in. So John, who's a fictitious patient name, is a patient who was in my office this week. Now this fellow has no inkling of Ayurveda. His wife has been a patient of mine for a long time, but not too much Ayurveda, a little bit. But he is suffering spinal canal stenosis, very, in a lot of pain. So he has spinal canal stenosis that was diagnosed in March, and he's facing possible surgery, and his wife literally dragged him into the office. He did not even want to see a chiropractor, much less an Ayurvedic practitioner. And I could see the resistance in his face and also his fear, because he was very scared he was going to have to go have surgery, which often brings them into our office anyway. I saw the pulse, and I spoke from my heart. You know, when I knew the situation. In this case, it wasn't just somebody that walked in off the street. I kind of knew the dynamics. And I was a little hesitant in my mind. Should I go there with him? Or should I maybe not? You know, because he's feeling... But then when he was sitting there and I could see his wife, and she was just like looking at me like, please do something for my husband. I thought, okay, well, there's the sign. So I took his pulse, and I spoke from my heart, explaining how the stenosis had been there for a long time before his symptoms, because it's a degenerative problem, but that the channels had become obstructed with toxins. And I told him that it felt like he was constipated, and the constipation was the possible reason that the stenosis had actually become symptomatic in March. I asked him if he was constipated, and he said yes. And I asked him how long he had been constipated, and he said about 1 month before the symptoms began. See the connection? He became constipated, channels blocked, boom, it started. I further explained how we can open the clogged channels with proper diet, spices, transdermal creams, etc., and chiropractic treatment. And then, knowing his reticence, I asked him how he wanted to proceed. I didn't want to just assume. And he said he wanted to do everything. Later, when his wife wasn't looking, he stuck his head in my door in my office right before he left, and he said, "I'm so inspired by your explanation, I can't wait to get started." You know, and there you go. So when we speak the simple truth, it can transcend the fears and doubts created by the mind, not only in the patient's mind, but in our own mind. And the truth is a very, very powerful medicine. It is the most powerful medicine. It is the power of Yuga medicine, and it's what we practice. Always start your interaction with each patient from silence through Nadi Vigyan. Then speak from your heart, not your mind. Not yet. The mind will engage, don't worry, it always does. But start from the heart. And in the appropriate manner, with the appropriate thoughts and words, the mind will engage. Through Nadi Vigyan, Trisutra Ayurveda becomes realized. This approach is Swa in true Ayurveda. The Vaidya is the one who knows because he's in touch with the field of all knowledge. He's in touch with the lively light of Sattva, or Ritam Bahara Pragya, as it's called in the Yoga Sutras, that knowledge from that level from which truth is known. As Swa practitioners, we have a special status because we're Vedic practitioners. There are no other Vedic practitioners out there. We practice from that level of truth, from that level of sattva. And we happen to be fortunate enough to be practicing a type of Ayurveda that remembers how to and how important it is to connect to that level on all parts. Our interaction with the patient, our prescriptions that we make, our analysis that we do is all out of Sat. So Swa practitioners connect to their own sattva, and from that level they become living expressions of the eternal principles of Ayurveda. Then we breathe and speak those principles to our patients, and that's true Vedic medicine. Because it's not just learning stuff in a book. It's not just getting a bunch of information. It's breathing sattva, life, into those prescriptions. Because we can have a lot of information, but which ones to choose? You know, I got all these creams here. Do I choose this one or that one? Where does that decision come from? If it comes from here, it'll always be correct. If it comes from here, sometimes it'll be correct, sometimes it won't. Any questions? Thank you. Thank you.
We have a question back here, Doctor.
Yes. Yes, the question is, are there cases that come in I don't feel I can treat, that I can't be successful with? Is that what you're saying? Absolutely, because we can't cure everybody. Ayurveda classifies patients in different categories: easy to treat, difficult to treat, impossible to treat, and impossible to treat but treat anyway. And so sometimes we get those, we have to figure out which people fit which category. Any other questions? Well, it could be receptivity, because that is one of the qualifications for a patient to be successful. They have to be open to the prescriptions that the doctor makes, because if they're not going to follow them, then that's not going to go anywhere. That you can usually figure out fairly quickly. But I was thinking more in the case of maybe the channels have ruptured, and I've had people come to me who have 2 weeks to live, and it's just too far gone at that point. And they're in the hospital under, in intensive care, and some family member says, can you fix something? You can't do anything at that point. It's too far for that one. Yes?
Yes.
Because that was the impossible to treat, but treat anyway. You see, and that came from here. You made that decision. You thought, I'm going to do it anyway. Right? That came from your light, and it was the right decision. Right? So you have to make that decision too sometimes. Yes? Yes, which verse in the Bhagavad Gita was I referring to? I don't know the verse number, I'd have to go look it up. Yogasta kuru karmani. Yogasta, Y-O-G-A-S-T-A-H. Yogasta. This is chapter 2. Kuru karmani. It's probably in chapter 2, verse 45. Yogasta kuru karmani. And then Nistragunya Bhavarjuna, that's where he's saying, be without the three gunas, established in being, perform action. That is chapter 2, verse 45. Okay, thank you.
Thank you, Dr. Beech.
Sometimes I feel that Dr. Beech and Dr. Marian Teitelbaum has direct communication with my dad. They behave like that and they receive like that. And it's really fascinating for me that how great they are understanding and presenting their thoughts. I'm really blessed. So it was amazing. Sometimes that's why I thought that this is a good idea to organize this kind of conference so they can come and they can share their thoughts, their experience, and tell everybody that how good it is. Wonderful. Thank you, Dr. Beech. Thank you very much.
Takadimi takita tatang, takadimi takita tatang, takadimi takita tatang, takadimi takita